Question 59. Nasal cavity and paranasal sinuses. The nasal cavity is an irregular cavity extending from nares to juane. It has a floor, roof, lateral walls, and is divided by septum into two halves. And the nasal cavity is bordered by some bones of the skull, completed by nasal cartilages and membranes, and it's lined by mucosa. Now for the external nose, you see it has a root, a dorsum, an apex or tip, ale, and nares. The external nose is formed by nasal bones and frontal processes of maxilla, nasal cartilages, where you have lateral nasal cartilages, major alar cartilages, minor and accessory alar cartilages, and septal cartilage. This is septal cartilage. So you see, this will be the external part. And then you have nasal muscles and skin on top of those. The nasal cavity is subdivided into a vestibule, respiratory region, and olfactory region. The nasal vestibule is slightly dilated and is lined with skin bearing vibrissae, these hairs. The olfactory region is limited to the superior nasal concha and opposing nasal septum and intervening roof. It is lined by olfactory epithelium containing olfactory receptors. Here you can see the olfactory nerve is going just above. And then the rest is the olfactory region, respiratory region, which is lined by respiratory epithelium, and it contains venous plexuses and numerous nasal glands to warm and wet inhaled air. Now for the paranasal sinuses. Firstly, you have frontal, maxillary, ethmoid, sphenoid, and mastoid sinuses. This one is not paranasal, so it won't be included in this one. Here you can see a coronal section, frontal, maxillary, ethmoid, and then sphenoid is back here. Here you have the orbits with the eyes, and yeah, nasal cavity. The frontal sinus opens into the middle meatus underneath the middle in nasal concha. The maxillary sinus also opens into the middle nasal meatus. The opening is called maxillary hiatus and is narrowed by the attachment of inferior nasal concha, so it's called a semilunar hiatus. The sphenoid sinus opens into the superior nasal meatus, and the ethmoid air cells, the anterior and middle, open into the middle nasal meatus, and the posterior ethmoid air cells open into the superior nasal meatus. and here again you can see the canal from frontal sinus. This is the lacrimal canal, opens into the inferior nasal meatus. And here you can very clearly see the superior nasal meatus, middle nasal meatus, and inferior nasal meatus. And then for blood supply of nasal cavity and paranasal sinuses. Here you have branches of facial artery, of maxillary artery, and ophthalmic artery. The nerve supply is by the sensory is by trigeminal nerve, and the muscle and mucous glands are bifacial. Here's the nasal cavity. So trigeminal and facial.